Thank you to the Alberta Equestrian Federation for giving me the opportunity to speak once again to the community in Alberta. I'm happy to do these things as often as we're called upon, so that we can try and disseminate information and try and quell some people's concerns over the insurance industry's approach to this, and how we specifically are addressing it in Alberta and across the country. The piece that Megan alluded to that will be posted is really essentially the structure of what I'm going to speak to today. So don't worry if I bore you to death visually and audibly. Then you can read the document at your leisure. So since this pandemic has sort of come to light, and since we've all been asked to do some very strange things in our lives and our businesses, insurers of all stripes, frankly, have been asked to respond to concerns being expressed by clients about coverages and about loss of income and liability issues, which I'm going to things that are not unique to insurance, but unique to this circumstance. Pandemic is new to insurers too. This is the first global pandemic in decades, if not certainly for generations, and is being compared to world wars and the Black Plagues and things that predate most people in the country. So insurers across the globe are struggling to do their best to respond to customers' concerns. They have a responsibility, obviously, in the community to do their best. And again, our purpose today is to try and help you understand the coverages that we provide to members of AEF. So I'll go to that specifically right now. If you're a member of the Alberta Equestrian Federation, you know that you do get some insurance benefits automatically. There are two policies. One of them is a personal liability policy. The other is an accident, death, and dismemberment policy. Those two policies, frankly, are not affected by COVID. They're in force. They've always been in force. Your exposures, as the insuring company understands them, are identical, whether COVID is present in our community or not. And specifically because liability, the coverage we provide, the liability insurance, is relevant to the ownership of a horse or a number of horses that are being used for personal purposes. Well, during COVID, your ownership of the animal presumably hasn't changed, which means that if the horse were to cause bodily injury or property damage to someone else or something else, and you were held legally liable because you own the horse, policy is going to respond. Predictably, even in these last 4 weeks across the country, in our work, we're responding to liability claims as a matter of course, and treating them as we always have, to make sure that our members in the various provincial bodies are protected as the policy is intended to do. The second component is the accident, death, and dismemberment policy, which is there to protect the individual member for catastrophic injury arising from an interaction with a horse. COVID is not a relevant risk in that regard, and to that end, the policy continues to do its work, and that policy remains fully in force. So the personal liability and the personal AD&D are unaffected by COVID, and that's an important issue. I've had a number of questions from AEF members and indeed members from across the provinces asking me consistently, so much it's really quite surprising, am I still covered because of COVID? Well, yeah, the answer is yes. Yeah, you are. You're covered. So that's the first part of this. The second part is a little bit more complicated, and that has to do with the operations that we insure under commercial liability policies, whether they be coaches who are in our coach program, or commercial liability policies that are providing coverage for large equine operations or small equine operations that provide services to the general public, that might include riding instruction but are not limited to that, that are boarding facilities or trail riding facilities or pack facilities or a number of horse show facilities, a whole range of operations that are involved in our industry. It gets a little more complicated in terms of what government is expecting those businesses to do. And I want to quickly digress to something Megan alluded to earlier. And we're all watching and listening very carefully to what governments are telling us across the country. Each of the provinces seems to have a bit of a different take on what is considered an essential service and what is not considered an essential service, what businesses can stay open and under what circumstances they can be open and what can't be open. And in Alberta, to the best of our knowledge, leading up to today's presentation, things haven't really changed for the last 3 or 4 weeks. Within the list of essential business services that are expected to stay open are stables. There's a specific reference to stables in the list. It's interesting that the paragraph that speaks to those that speaks to stables is exactly the same language that's being used in other provinces, including here in Ontario. And there's no question in my mind, having done some research on this several weeks ago, that the purpose in governments across the country, including stables as part of those essential services that should stay open, is to recognize that stables indeed are the housing that is provided to large animals, horses included. So we need to have stables open so that the animal's health and welfare can be maintained. But in that same paragraph, it won't come as any surprise, there are other references to animal care facilities like kennels and catteries and zoos, other places where animals are housed. And again, I stress the fact that the intent is we believe that the intent of government's inclusion of those businesses is so that the animals can be maintained and cared for by essential caregivers. And that will be a nice segue to what is an essential caregiver in the context of our facilities. But I stress the fact that the operations of the stable is a different matter as compared to the stable itself remaining operational so that the horse's health and welfare can be maintained. So let's speak to the operations that might be found in a stable. As I alluded to before, there are, and everyone on the call knows this, that there's a myriad of things that happen at stables. There's riding instruction programs, there's education programs, there's equine assisted learning programs, therapeutic riding. There's all kinds of trail rides, pony rides, and wagon rides, sleigh rides. There's a whole range of things, horse shows, clinics. All of those operations are very separate from the actual stable operation as defined in the government, and as far as we're concerned, that speaks to the animal's health and welfare. And I'm sorry if I sound repetitive on that whole notion of horse welfare, but I think what has troubled so many people in our industry from coast to coast is this notion of they want to ride, they want to be involved with their animals, owners of horses particularly, boarders and so on. And I respect that. I don't own horses today, but I certainly have had many horses in my life. And so I recognize that bond is very real and very important to many people. But operators of businesses have this other responsibility, which is primary at the current time, and that is to make sure that the animal is taken care of first. The emotional needs and even physical needs of a rider or an owner, frankly, have to take second sort of stage to this. Governments in all provinces, including Alberta, have made it quite clear that really what they would prefer, if given the choice, is that every one of us would be staying home in our living rooms for a period of time, so that this darn COVID-19 could be squished. I'm tired of talking about squishing down the curve. I just want the whole thing gone, like everybody else. We're all getting quite tired of being isolated or being asked to social distance and so on. And clearly, the only way that we're going to do that is to continue to do the things that government and health officials are telling us to do. So let's talk about what constitutes an essential caregiver at a farm, which is obviously the thing that most people are concerned about, and what they're allowed to do and what they're not allowed to do. First of all, I have to say to you as an insurer, as a broker, that the insurance company is not going to tell you what to do and what not to do as far as your business is concerned. We can't do that. We can make recommendations. We can give you technical definitions of what the policy says, but we can't tell you how to operate your business. That's entirely your decision. What we can say is that if you're breaking the law, as stipulated by government, who have the authority to make laws, if you're breaking the law, the insurance policy will not respond. And that's true of all insurance and has always been true. It has nothing to do with COVID. So it's an important distinction, and one that people have to be aware of, which means to say that they have to be paying attention to what government is allowing operators to do and follow those guidelines quite clearly as best to their ability, And if they do those things, then the insurance policies that are provided to those businesses will respond as they're supposed to. If you fall outside of those guidelines, if you fall outside of those rules and regs and laws that have been stipulated, then you're not going to have coverage. It's just as simple as that. Or at least your insurance company would reserve the right not to respond. And that's a very important element here. So when folks talk to us about, can I let my boarders come to the property? I would have to say to you that the intent of the legislation as it is today is not for business operators to facilitate horses being visited by boarders. That being said, I think boarding operations have an obligation and certainly the right to allow people onto the premises that would provide an essential care to the animal, that would provide essential care to the horse. I mean to say a veterinarian, a farrier. If staff and the owners of the facilities can't manage the entire herd to make sure that they're taken care of, then of course they're going to have to let others onto the property. But the question is, what are they going to do when they come to the property? What's the intent of the visit? Keeping in mind, again, the government would prefer that they are not at the barn, that they would stay at home. And in my mind, what that really means is that if a boarder is necessarily going to visit their horse, that they are doing so with the express purpose of providing rudimentary and essential care to the animal, and then leaving the property. And that's the end of it. That may mean walking the horse, that may mean lunging the horse, it may mean assisting in turn out and turn in, because the facility can't manage the entire herd, and there's lots of barns that have that limitation. Certainly, when I ran a boarding place, and I did at one point, we had 42 boarders. There was 4 staff, and certainly in a perfect world, we can manage horses coming and going and throughout the day. In this environment, if even one of those staff was sick, I can't even imagine. I'd have to have boarders help, because we couldn't possibly take care of all the boarders' horses with 3 people to get them all out and exercised. So there are going to be nuances in each of the barns that you're involved in, and they need to be taken into consideration with the primary objective of only providing rudimentary and essential care to the animal. For boarders that would argue that essential care involves riding, I defer. I can't speak to that. I've told a story in this presentation a few days ago, and in other presentations I've done in the last couple of weeks. When I was horse showing, I had a thoroughbred mare that was frankly never learned how to be a horse as a baby and could not be turned out for her entire life. I had her for 12 years before she was sold to a kid. But the reality is she could not be turned out. If she did, she would run blind. She would hurt herself. She would hurt anything that came her way. She ran through paddock fences when we tried to make her a horse and make her relax out in those environments, but she wouldn't do it. She wouldn't lunge. These are just things that were special to this animal. We didn't push her to the point where we wanted to injure her. So if she was going to be exercised, she had to be under tack. So if I was a boarder today with that mare, I would certainly be having a discussion with the boarding place saying, look, this mare cannot be turned out. It cannot be lunged. I appreciate that you're trying your best to help me with my horse to take care of it. The reality is it needs to be ridden. And presumably the boarding facility would recognize that need and know enough about me and my horse to know that I'm not up for a recreational ride. I'm there simply to do the things that are necessary to maintain the health of the animal and allow me to ride in a controlled environment so that everybody remains safe. The biggest fear that we all have is that we're jamming up the medical system. Nobody wants to be that guy that came off the horse and is taken off to a hospital by ambulance and has been putting burden on the medical resources that frankly are highly dedicated at the moment to COVID-19 patients. It would be tragic, especially in a preventable environment like riding. Riding lessons, frankly, I think are not acceptable activities, and that's my opinion. I haven't had a government official tell me that they can't do it, that a coach can't go teach, but I think there's this balance between being morally responsible and legally responsible. And I would guess that most of us would agree that a coach who is perhaps under pressure from a client, a rider, to come and give a lesson because there's not much else to do right now. They're not at school, they're not at the job perhaps, and the student just wants to get out and do something. I appreciate and respect that, but I don't think the coach should be facilitating that unless they can truly and morally sort of settle in their mind that the only reasonable way to keep the horse healthy and sound at this particular time is to have the horse ridden. And if the facility is unable to provide that service, then by all means, the owner of the horse should be riding the horse, as I mentioned a moment ago. And coaches can then participate in that activity. But I had a great conversation with a high performance coach this morning, and I've had several of these in the last couple of days. And we were talking about the professionalism that coaches can demonstrate right now to be responsible in their prowess, to say, look, as experienced horsemen and women, we have a responsibility as coaches to treat the rider athlete and the horse athlete as a team for a good chunk of the time. But frankly, they're separate things and separate projects in many cases. And if the coach can turn their attention towards the horse and use the resources, including the rider, the owner of the horse, as a means to take care of the horse, this is a learning opportunity from between the coach and the student. In my view, it's a chargeable fee sort of environment. If I'm going to come out to the barn to watch your kid ride, whether I'm teaching the kid to sit up straight and put their heels down, or saying to the kid, really what I want you to do right now is remember that we're in a very special environment. It's an unprecedented time. Let's learn about the physiology of this horse that you ride all the time. Let's talk about what its needs are. Let's talk specifically about things that we can do together between coach and rider, horse professional and rider, trainer and rider, to make sure that the horse's health is paramount in our minds collectively, so that we can get through this as quickly as possible. And when we come out the other end, we've got a sound, healthy horse for you then to continue in your riding career, in your riding training, whatever those things may be. And in my view, that is a chargeable sort of environment. I don't know why it wouldn't be. And if coaches, I think, can sort of get their head around that, then perhaps there can be more interaction. All of that is predicated, though, by the permissions that must be given solely by the boarding place if they're different entities. Facility managers and owners of land and buildings have the sole right, in my opinion, to disallow or allow people on their premises at any time. There is no God-given right because you board your horse at my farm that I have to let you on the property whenever you see fit. That's simply not true. I will decide when you come to the barn. And if boarding places are trying to facilitate the needs of their boarders in the context of things like I've discussed this morning, then they can certainly do so with a schedule. They can do it so that they're maintaining and respecting the social distancing guidelines that have been set up by government and health officials, and talk about timing and sanitization, and reminding people that if they're going to come to the farm that they have to be sanitized as best they can be before they get out of their car, and they don't touch any surfaces they don't need to touch, and they don't congregate in the tack room or in the viewing room. They don't do the things that they would normally do because these are not normal times. And to bring their own sanitization equipment. I've had a number of facilities say, we're doing our best to keep the place spotless and sanitize it under these extraordinary circumstances, but we're running out of supplies. So I don't think there's anything wrong with saying to boarders, look, if you're going to come and ride, first thing you're going to do is get your tack and equipment out of the tack room. You're going to get your brushes out of the tack room, your helmet out of the tack room, all that stuff. It now lives in your car, or it lives in your house. So during the course of this pandemic, if I allow you onto the farm Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, whatever that schedule looks like, you're bringing your stuff and you're taking your stuff home, because it eliminates the need to touch or go around the barn in a way that they normally would have done so before. Having run a barn, I mean, I admit I'm stressed just thinking about how difficult it must be for facility managers to sort of recognize the need to be sanitizing surfaces in a barn, where a boarder might, they're opening the stall, they're messing around in the stall with their horse, they're doing things that would be very normal under normal circumstances that are very difficult to track. And I don't think any of us can underestimate the risks associated with facilitating those visits to the farm for the health and welfare of the family that owns the farm or manages the farm, for the staff that work on the farm. I can't tell you the number of folks that have phoned and said, look, I've got a mother-in-law that lives in my basement. I don't want my boarders here. What am I going to do? How do I tell them politely, I respect you, I'm grateful for your business, but I can't have you here right now because I've got a family member that might be compromised by your presence. And for boarders to be bullying, and I've had that story as well many times, saying, well, too bad, too sad, my horse is there and I'm damn well going to see it. I got to side with the operator of the barn. I really do, and I don't think that's unreasonable. So anyway, that's a bit of a long-winded sort of talk. I've been asked a question point blank, can I ride my horse, just as a question, and I can't tell you that. Insurance companies are not lawyers, and we're not the police. If the government of Alberta said you can't ride a horse, then it would make it very easy for me to say that, but I can't because they haven't, and so we have to defer. I've been asked by some if someone came to the barn and went away and got sick, and suggested that the facility was the focal point of the contraction of the COVID-19. Could they sue me? And if they did sue me, would my policy respond? I don't know, because frankly, there's nothing in the wording that speaks to pandemic or disease being acquired while on your premises. I'd like to think it would, but frankly, it's an unprecedented time. So insurers of all stripes would have a hard time being categoric in their answer to say yay or nay. I think it would be very difficult to prove, but who knows? And it's again, because we're in these very unique times with a very unique enemy, this COVID-19. It's quite challenging for any of us to sort out what we can and can't sort of cover. So with that being said, I've been on here for 20 minutes. I've probably twisted enough ears. I hope that there are some questions. I will say this, Megan alluded to it before, that there's an email in the attachment, and I think Erin may have put it up, or Hillary may have put it up as well in the chat room. That email address comes directly to me. It doesn't go anywhere else in the organization. I'm sort of the point person on the pointy end of the arrow on the COVID issue across the country, and I am responding to every email and every phone call as fast as I can, and there have quite literally been thousands, and I will continue to answer those inquiries that may be specific to your situation, or just general questions about how to manage this. We are vested in this industry, I assure you. We are very concerned for all of our clients and for the industry in general, looking down the road and seeing the struggles that some are having now. And in fact, I was on a webinar this morning with an employment lawyer. We were speaking about, or the group was talking about some of the programs that are available to small business operators that are being provided by the federal government, and which is astounding how fast they've been able to accomplish the things they have accomplished, knowing that there are holes in it, but nonetheless they've done a very, very good job, in my opinion, being apolitical, that to get some opportunities for people to get some resource to them. We know in the horse industry that many of the businesses qualify, that are truly registered with government and pay their taxes and have employee-employer relationships, issue T4s and all those things. Well, those folks that are under that structure and are sort of playing by the rules, as it were, for small business, certainly there's some opportunities to get some relief, and that's good news. For others, regrettably, it's not as easy, because they've not operated, or they've been operating sort of in the gray economy, and they're going to be challenged, I fear, and I hope that the community can help each other to help those that may be in a very difficult situation right now, trying to keep their animals fed, to try and keep client relationships, which we're all very concerned about, obviously, over time, and to make sure that when we do come out the other end, that the horse industry comes out stronger and more together, perhaps, and recognizing that the issues like this demonstrate to me again and again and again that we have much more in common than our differences, and horse industry people are infamous for not talking to each other in their various communities, and that's regrettable. It's always been regrettable to me, but maybe this will be one of those issues that helps us come together, so maybe some good will come from it. So anyway, I'll stop talking now, Megan. I will turn it back to you, and maybe there's some questions.
Well, that's great. Thank you, Mike. So what I'm going to do is I'm going to share my screen now with the document that Mike was speaking to earlier. And so this is just kind of a chance for you to see. But again, this will be coming to you via email, of the email that you registered with. So again, if anyone is calling in by phone today, please reach out to me at marketing@albertaequestrian.com if you'd like to be included in that email to have this document sent to you. So we'll get to the questions now here in the chat.
And Megan, is that document posted at AEF's website?
It is, yeah. So
Okay.
we do have a, on our homepage of our website, at the top, we do have a banner that is doing, we're constantly updating and keeping updates on the current situation. So you can visit the resource page from there. So it is at the homepage at the top, in red, you'll see it. So it is there under the CapriCMW information. So you can find it there as well.
All right, I guess we'll get to question time now, guys. So if you have any questions, please feel free to post them in the chat box now. And thanks, Mary. Perfect. We see that Mike has answered your question for you. Give her a few minutes here.
You also can raise your hand as well for us to unmute you if you have any questions. Okay, well, we'll give everyone a few more minutes here if you kind of think of a question coming up here. Mike, is there anything else you'd like to speak on, or anything that's come to your attention as of recent that you'd like to
no, here's what I'll say is that the government's doing their best. I think the community's doing its best. We know that this is very disruptive. We think the riding instruction programming, I think we all agree that that's not an acceptable sort of activity right now. But I want to stress again that if there are coaches on the call, that this is a great time for you to demonstrate your abilities as a professional horse person, to focus attention on the horse, which is obviously integral to the business and integral to the relationship, and demonstrate your desire quite overtly that to keep that horse healthy and well. We know we're going to get colics. I've had 3 this morning from across our program. I had 4 the day before yesterday. We know horses are going to be challenged during this time because they're not necessarily getting the same attention that they that they usually get because there's restriction of people moving around, and it's a great opportunity for coaches and other professionals who are hands-on in the industry to step up, to get involved more aggressively with management of the animal. And again, I go back to my thoroughbred mare, just as a quick story. I mean, this mare that I referred to, she horse showed with me. She was a working hunter. She was a brilliant horse under tack, just a pussycat. And I can imagine, again, and I've often thought of her in this environment, and thinking, she probably would have benefited from a bit of a break, even at this time of year, because she would have been schooling all winter. She would have been pretty show fit at this point. Horse shows here would have already started by now, and frankly, to have her let down again would be a little frustrating. But knowing the horse and knowing her the way I did, it would not have taken me long to get her back to show fit, and I certainly think I would have been no less show fit than others that I was competing against. So that I take some solace in that. I don't think anybody's chasing points this year. I think we can all agree there's probably not going to be many horse show or even clinic opportunities in 2020. So anybody who's sort of stealing to get out in horse show again and keeping their horse super fit, or trying to keep their horse super fit with that prospect, I think is chasing a dream. I doubt very much is going to happen. We'll hopefully be able to enjoy horses in our sport soon in environments that are safe for everyone, and we'll look about horse showing next year. So.
Okay, thanks, Mike. So it looks like we do have a couple of questions rolling in here now. So Jessica did have a question. She's wondering if you are able to speak at all about the provincial government giving out forced closure letters to facilities with who are still operating their lesson programs.
I can't, because I'm not aware of any. If anybody can show me a document that shows a government official entering a private facility to shut them down based on a specific complaint or environment. I'd love to see it. If this came from Facebook or social media, I caution. I can tell you in the last 3 weeks, I've been accused of handing out $50,000 fines to clients, to canceling clients, to calling the police on clients, which is obviously not true. But it's really quite surprising how, to me, always, not being a Facebook person, how folks will turn to that as a resource of credibility rather than turn to their own government. If someone needs an answer about whether or not they should be operating their business, they need to be phoning the government and saying to them, I operate a riding facility, or I have borders on my property. Can I allow them to be on my property? Yes or no? I suspect the answer will be a controlled yes if they understand. If someone asks, can I run a riding lesson program? You will probably be told no, which is consistent with what social distancing is about. Does it mean you can't coach if you're a coach? It's up to the government, guys. It's not up to us. It's not up to us.
All right, so the next question is actually for the AEF, and Megan will help you out there, Stephanie, for that one.
Yeah, so we will, so we have been recording the sessions for this one. We will have them posted soon. I will have the audio ready. The video will take a bit longer, but they will be posted on our site shortly. And what I can do is actually send a follow-up to all of the people who joined us today, just saying that they are available for you to view at a later time as well. So they will be there, hopefully soon, within the next week or so.
There we go. All right, so it looks like the next two questions are kind of similar because we have clinics involved there. So Laura and Jessica are both wondering about clinics. Laura says, I am confused about some facilities still doing lessons based on social distancing. Also, clinics going ahead with the theory of a one-on-one kind of social distancing atmosphere. Do you have any feedback on this?
Well, clinics are just lessons, in my view. So I'll speak to that first. So one-on-one, again, I have a problem philosophically with coaches or clinicians suggesting that even with social distancing, which we all know is probably more than adequate to satisfy government recommendations of 2 meters. I mean, we know the coaches aren't that close to horses, or clinicians aren't that close to horses. But again, I question whether or not that's appropriate at this particular moment in time, given the fact that social distancing is only a part of the equation here. That clinician or organizer of the clinic or organizer of riding lesson programming is facilitating people leaving their home with the express purpose of participating in what clearly is a recreational activity. I doubt very much government would look very favorably upon that if they understood it, and they may or may not, depending on who you speak to. So is it legal? I can't answer the question. The government officials are the only folks that can dictate what a business does, what a business doesn't do. But again, I question that whole notion of, is this the appropriate time to be running clinics, to be running lesson programs? I don't think it is, to be frank. I just don't. I don't think that that's in the spirit of what the legislation in every province has put out. I certainly know in my own life, although I'm not riding at the moment, I got to tell you guys, I go from this office to my home and back again. Like, that's it. You know, if I have to go to the grocery store, it's easy for me. It's around the corner. But we're going once every 2 weeks. I mean, we're just doing what we're supposed to do. And I hope that everybody's doing that, because the more folks that do what they're supposed to do, the faster this all goes away. So it's one man's opinion, and I have to qualify that, but it comes from some experience, and it comes from understanding the needs and desires of these clinicians and coaches and facilities who are looking for income opportunities. They don't want to lose track of their client relationships. I respect that, but there are other ways to do those things. Clinicians and coaches can do video lessons, not on horseback, and I repeat, not on horseback, but they can be speaking to the rider athletes and saying, you need to stay fit, whether your horse is coming down or not, or is not going to be as fit when we finish this. You need to be as fit. You need to be prepared. You need to continue to do calisthenics and core training and watch your diet and do the things that you need to do as a rider athlete. That's also the coach's responsibility, in my opinion. So there are opportunities for coaches to maintain relationships, maintain dialogue, be professional, and still do the things that we're being asked to do socially. There.
Okay, so
I could go on all afternoon. Don't make me.
It sounds like you did touch base there, Mike, for Jessica's follow-up question about private clinics and your recommendation for if they should be canceled or not.
They've got to focus on the horse, Megan. That's the bottom line. Focus on the horse. Stop focusing on the rider. The rider will be okay. God forbid they're asymptomatic and they come to the barn, even to ride their own horse, and then they contract. They don't contract it, but they give it to somebody else. I can't get past that. Sorry.
All good, Mike. Jessica also points out here, she says, I also worry about the implications if a facility allows an outside clinic to be booked and take place at their facility during this time. Which, yeah, of course, we understand that implication as well there, Jessica. Do you have a specific question, or is that just sort of a your view on that? See if she has a follow-up there. Also, if there's any more questions, guys, please feel free to put them in the chat or raise your hand.
Somebody's got to do the raise the hand thing. We had that the other day. It was so much fun. And
Yeah.
Megan going, you in the back with your hand raised. Now your microphone's on. Speak. It was perfect.
If anybody wants to take the plunge and chat.
Jeez, Jess. So I saw the beginning of Jessica's question. What was the second part of it? And the last.
She said, just reaffirming, because I know some taking place in the next few weeks that have not yet been canceled.
Well, again, it's up to the facility operator. They're doing so of their own volition. Not for us to judge. Sorry, I will do that outwardly, but whether or not it's legally right or not, I can't answer the question. I just can't. How many folks are you guys allowed to be in a gathering in Alberta right now? Here it's 5, so it's a pretty small group, and that's everybody. I mean, in fact, the government has said if even 5, if you're not family members, they're going to question. But what is it in Alberta right now?
I believe it's 10 the last time I looked. It may have gone lower though, as things have been pretty progressive here.
So how do you run a clinic when there's only 10 people on the property? I mean, everybody.
Yeah.
That means grooms, that means riders, that means auditors, the facility staff, the facility owner. How do you justify being? You couldn't do it with 10. You couldn't do it with under 10.
Mm-hmm. So I just double checked, Mike, and so as of updated today, no gatherings of more than 50 people is allowed in indoor or outdoor location in Alberta right now.
Okay, there you go. So.
Okay, so we have a question from Laura. She's curious about horse clubs, such as drill team. So her question is just, what about horse clubs like drill team?
Well, again, we're back to that whole social distancing thing, and whether or not doing drills as practices on horseback at the same facility at the same time is in the best interest of anyone in the community. My personal opinion is no, it's not. But that's a personal opinion. Again, it's facilitating all those folks coming to one place to do something that is, for all intents and purposes, recreation. And I would have to say that that's not necessarily. It's not in the spirit of the legislation. Again, keeping the horse as the focus. Do these folks have to ride? Perhaps, depending on their horse. But do they have to ride together? Probably not. Do they need to be practicing drills? I would say no. But again, I defer. If a question needs to be asked to say, the 6 of us on the drill team want to get together on Saturday at Mike's farm, that question should be posed to local health authorities with the understanding that you might not get an answer that you want. But frankly, that's where the answer should be coming from.
So Stephanie does say, I really appreciate all the information regarding the spirit of the legislation and doing what is morally right. My full service barn is not open to boarders. Other barns, however, have designated boarders as essential workers, which is fine. She says, however, there are yet other barns who are allowing riders to visit and or ride on a schedule when they are clearly there for their benefit, not the essential care for the horse. Agreed that this does not meet the spirit of what the government is asking you, as you have pointed out. So it sounds like Stephanie likes what you're saying, Mike.
There you go. No, listen, not everybody's going to like it. Not everybody's going to like it, Megan. And again, it's a very challenging time. You know, I don't like the fact that I can't go to my running group. I run 3 times a week with a bunch of guys, and I can't do that. And to me, that's the same as people wanting to go to see their horse. To be honest, it's my mental release. It's my bonding time. It's all those things that are really important to me. And again, everybody's got to suck it up. It's hard. It's very hard. But we just got to do it.
So the equine email that goes directly to Mike, that again will be on the form that is up on the screen share now. The email is equine@CapriCMW.ca. So again, thank you so much for joining us, and a big thank you to Mike. We really appreciate you coming on today and speaking to everyone and speaking to everyone's insurance questions and everything that's come across on your desk in terms of insurance. It's been really helpful, and we really appreciate everyone joining us.